Hello, everyone. My name is Nomanite Shangam, and I'm a senior scientist of research and development at Gallant Therapeutics. And today I'm happy to give you the talk entitled Pilot Efficacy of Allogeneic Uterine-Derived Mesenchymal Stem Cell for the Treatment of Refractory Feline Chronic Gingival Stomatitis. Just disclosure that this study was funded by Gallant Therapeutics, supporting our platform of allogeneic, ready-to-use, uterine-derived MSCs for companion animals, currently undergoing investigational use for FDA approval. Feline chronic gingival stomatitis, or FCGS, also known as caudal stomatitis, is an inflammatory oral disease affecting 1 to 2 million cats. The disease is characterized by sustained inflammation that crosses the mucogingival junction, extending the buccal and caudal oral mucosa with proliferative and ulcerative lesion. FCGS has a complex etiology with an immune-mediated pathogenesis and possible comorbidities with multiple pathogens and environmental stressor. Cats with FCGS exhibit an overexpansion of CD8-positive T cells population, and the current standard of care is medical management with anti-inflammatory or immunosuppressants and dental extraction, either full mouth or partial tooth extraction. Despite aggressive and medical and surgical therapy, approximately 30% of affected cats will remain symptomatic or considered refractory and have a declining quality of life, often resulting in euthanasia or natural death due to reduced appetite. As mentioned earlier, refractory FCGS is unresponsive to current standard of care, and affected cats have no other treatment options. Studies evaluating both autologous and allogeneic fresh culture adipose MSC has shown promise for efficacy. However, there's a need for a ready-to-use GMP manufactured product with proven potency, sterility, purity, and stability for practitioners. Uterine-derived MSCs not only offer a dense source of multipotent MSCs, but are collected from routine donor space, who otherwise tissue would be discarded, and have a unique characteristic profile, making them ideal for therapeutic use. The main use of the UMSCs lies within their ability to interact with various immune cell subsets that are dysregulated in FCGS, and they secrete immunomodulatory factors that help normalize the cytokine profile and allowing both the oral lesion and clinical status to improve. So uterine-derived MSCs are unique from other cell sources in that they are comprised of MSCs both from the stromal cell's origin and the epithelial origin from the secretory part of the endometrium. The two cell types are differentiated based on shapes and sizes. The stromal cells are typically spindle-shaped, and the epithelial are cuboidal shapes and grow in clusters. UMSCs have typical MSC surface marker, including CD34 positive, 44 positive, 45 negative. The CD105 varies depending on cell type, and both cell types are MSC class 2 negative, making them immunoprivileged. Gallant cells undergo a rigorous testing process from donor through master and working cell bank to final drug product. The donors are confirmed healthy and free from relevant infectious pathogens and qualified according to the FDA guidelines. Cell bank was created from culture and expansion and carried out to final drug product. Stability, post-thaw recovery, genomic stability, challenge differentiation, identity, sterility, potency, endotoxin, and mycoplasma testing was performed for batch release. This study was designed to allow cats with refractory FCGS to receive 2 injections of a target dose of 20 million cells 14 days apart. Outcomes evaluated were oral lesion scores and owner assessment with key visit at day 90 and day 180. 3 veterinary dental specialist clinics participated in this study, and they enrolled a total of 21 cats. These cats were defined as refractory and were at least 6 months post-surgical extraction. Optional third dose were allowed for some of the patients at varying intervals following second dose if requested by the veterinarian for compassionate use. For this study, the drug product was cryopreserved in cell-seal vial and shipped in liquid nitrogen to clinical sites. The vial will thaw immediately prior to administration in a water bath at 27 degrees Celsius, and then diluted with PBS to yield a total volume of 30 mils. The cells were given intravenously in a cephalic vein using an extension set and a syringe pump at a CRI of 1 milliliters per minute. The cats were monitored continuously throughout the infusion with vital assessed every 5 minutes, and then 15 minutes and 1 hour following dosing. Follow-up was done in person or via phone the next day. The outcome measure investigated in these studies were the assessment by the cat owners for overall response based on objective assessment of quality of life, grooming behavior, interested in people and activities, or other relevance behavior for the individual cats. Success was defined as the owner assessment at day 90 of mildly or greatly improved. And for the oral lesion score, they are examined by the same veterinary dental specialist each time, included 8 different areas rated on a scale of 0 to 3, according to the level of inflammation, for a total score of 0 to 24. The success was defined as 25% increase or greater decrease in, success was defined as a 25% decrease in lesion score at day 90. So in addition to clinical relevant outcomes, the cytokine profile and potential clearance of virus in the oral lesions was also determined before and after cell therapy. At day 90, 78% of the owners reported either great or mild improvement. Lesion score were improved at least 25% in 48% of the cats as evaluated by dental specialists. Owner assessment of overall outcome at day 180 was available for a total of 11 cats, with 45% of the cats remain greatly or mildly improved. This data suggests that the owner assessment of improvement may precede the reduction of lesion score in some cats. The owner scores are more relevant to the FCGS overall improvement of quality of life. Interestingly, the lateral and gingival mucosal region appear to have the greatest decrease in response to therapy based on both change in the mean lesion score as well as the percentage change from baseline at both day 90 and day 180. By day 90, the percentage change from baseline demonstrated effectiveness. Here's an example of a reduction in lesion score in one cat following treatment with the UMSCs that has 79% decrease in oral lesion score at study exit. Note the marked reduction in proliferative and hyperemic area lateral to the palatoglossal fold. A number of cytokines also measure at baseline, and then again at day 90 and day 180 following treatment. So this includes IL-4 and IL-5, which are Th2-mediated cytokines. It is known that FCGS cats exhibit an Th1-mediated overexpression. This is supported by the low level of Th2-mediated cytokines at baseline, and further supported by the increase seen in this cytokine following treatment. Interestingly, in the non-responder cat, they often had an undetectably low level of each Th2 cytokines despite the treatment, suggesting severe immune dysregulation based on T cells profile. An important aspect of the ability of the UMSCs to immunomodulate in this population is also associated with the viral status, specifically for feline calicivirus following treatment. 12 out of 20 cats tested positive at screening for FCV. Out of these 12 cats, 6 were positive at day 90, and 6 tested negative, suggested clearance of the virus in half the cats that were treated. Efficacy at day 90 for both owner outcomes and lesion score was similar regardless of vital status. However, 4 out of the 6 cats that were considered responder tested negative by day 90 and remained negative at day 180, while 4 out of the 6 cats that were not improving remained FCV positive. This further suggests that response to UMSC treatment in refractory FCGS with chronic FCV infection may be associated with clearance of the virus. In addition to efficacy, tolerance was also assessed in this pilot study. No serious adverse event was observed, and there was only one infusion-related adverse event out of 42 infusions. One cat vomited 6 minutes after administration of the first dose, and the cat was treated with diphenhydramine and meropenem IV and recovered uneventfully. So 4 other adverse events were unrelated to the tolerance of the final drug, but were associated with disease progression. And 1 animal was euthanized due to deteriorating chronic kidney disease and pancreatitis. Overall, this pilot study supports the use of UMSCs for the treatment of refractory FCGS. At day 90 following treatment, 78% of the cats showed improvement in owner assessment, as well as 48% showing a reduction in oral region score. 66% of the FCV positive cats that responded to treatment become FCV negative after cell therapy. So Galen currently has an ongoing second pilot study that is finishing up, as next month will be the start of enrollment of our pivotal clinical trial supporting conditional FDA approval. Upcoming studies will evaluate larger sample size, both full mouth and partial mouth tooth extraction, treatment with UMSCs at an earlier stage of 2 months rather than 6 months post-extraction, and also further investigation of clinical relevant outcomes. To support our upcoming pivotal clinical trials, we have also ramped up our manufacturing process and demonstrated growth of a qualified feline urine donor out to 50 population doublings, which is about 20 passages, with retained growth rate and identity. We also evaluated potency and genomic stability on cryopreserved UMSCs to read passages greater than the cryopreserved drug product. An average size of 3.5 grams of uterus can generate over 30 million doses of allogeneic ready-to-use frozen drug product. This proof of concept study was designed in collaboration with Dr. Boaz Asri's group at the University of California, Davis. Thank you for your attention, and happy to take any questions.
Thank you. Wait, I know there's a question, but we don't have time. So one question, please, and then we can, Cass can reach out to Nopmani.
I'll be at the booth later if you have any other questions.
Yeah.
Hey, Nopmani, great talk. Thank you very much. It looks like lots of people have lots of questions for you, so we can catch you up later. I'm really curious about calicivirus, where it's been shown in previous years, right? It's like there is increasing evidence to suggest that it's actually the causative agent, but then recently the group from Cornell published a paper where they really tried really hard to find the virus by IHC and RNA scope, but couldn't find it there. And you guys have done that by PCR, so I just wonder, did you try to do any IHC or RNA scope, or actually seeing if it's in the tissue as opposed to just nucleic acid?
No, we have not. Since it's kind of like a multi-centric studies and also with client-owned, it's a little difficult to obtain either like oral biopsy or anything more intensive than just swabs to do qPCR.
Thank you so much.
Thank you.